Hello, my name is Letitia Davis, and this virtual presentation today will be on postpartum depression. This topic was of great interest to me because I am a woman with two biological sons. Also, someone very dear to me went through this experience. So, today, I have a friend, Yvette Crawley, who will share her personal stories and experiences with this disorder. Doctors and clinicians didn't recognize this disorder as an actual condition for many years. Therefore, I wanted to continue to bring awareness to this disorder. What is postpartum? Postpartum is a form of depression that some mothers experience following childbirth. This disorder is said to be brought on by the combination of hormonal changes after delivery in estrogen and progesterone levels. Who is usually affected by this disorder? Researchers believe this is a widespread disorder that affects 10 to 20% of all new mothers. Some of the symptoms of this disorder would be insomnia, loss of appetite, intense irritability, which may look like everything is getting on your last nerves, the crying, the washing of the bottles, trying to keep up with the housework. Another would be anxiety and fatigue, difficult bonding with baby, feelings of inadequacy.
I first realized that something was going on with me within my body, within myself, approximately 6 months actually after having my second child, which was my daughter. Some of the things that I started to feel or recognize that was a little off or different was that I really felt like sad. I couldn't get up out of like a sense of sadness that came along with crying spells. And the crying spells were taking place for situations and things that just really didn't even call for a need to be crying. I mean, something as simple as my husband asking me about my day, or just hearing my daughter cry, even my first child just asking me for something that he may have needed. So like I said, just very simplistic situations that would occur. And I just found myself starting to have more crying spells. And like I said, just feeling really sad and down. And then that started to lead into feeling sense of anxiety and insomnia. With my sense of anxiety, I started to feel heart palpitations where I felt like my heart was always racing, just very jittery, like nervous like. And then I also started to deal with some insomnia. Of course, you naturally have a bit of insomnia when you first have your child. But like I said, at this time and point, my daughter was going on about 6 months, 6 months old now. So the sleep deprivation should have been coming to an end. However, I started to experience more of the sleep deprivation when my child was actually, in fact, sleeping throughout the night. When it was time for me to run errands or go to a doctor's appointment or take my daughter or my son to one of their appointments, I started getting to the point where I was afraid to even drive. This sense of anxiety brought upon a feeling of doom, as if I was going to always die. I always had that sense that something was going to happen to me, whether if it was I was sleeping, I felt that I was going to die in my sleep. If I were driving, that something was going to happen to me or hurt my baby. I looked fine on the outside, but it was just a matter of what I was feeling on the inside, which always felt to me as if something were wrong. Like I said, that I was going to fall apart or or possibly die. So because of that, I constantly requested to go to my husband would leave to go to work. Like I said, I was very nervous and hesitant about being home alone with my daughter because, for one, it was very difficult for me to get my day going, to get started, to get out of bed. Like I said, I would have the crying spells. I never knew when I would feel that racing heart that I was experiencing, when that would start, or when I would feel as if something was going to happen.
What are some of the
So
causes of this disorder? Some of the causes are hormonal imbalances, past traumas, biological perspectives. With that would deal with one's genetic makeup. Sociocultural perspectives, this would deal with one's environment and the effects that it may have had on an individual, such as being sexually victimized, grief, sickness of a family member, and stress. What are the treatments for this disorder? Some of the treatments would be psychotherapy, cognitive behavior therapy. Cognitive behavior therapy focuses on challenging and changing thoughts, beliefs, and attitudes associated with the behaviors, and it helps you develop personal coping strategies to help you through. Biomedical therapy is treatment with medication. Is this condition curable? Postpartum depression symptoms often disappear entirely after about 1 year. Some clinicians believe it is curable with therapy, medication, and with time. Luckily, then I was able to schedule an appointment with my primary physician, and this probably took place about maybe 3 weeks after I had been going through this cycle of the crying spells, the insomnia, the anxiety, and running back and forth, like I stated before, to the ER a couple of times there. So, upon going to my primary physician, she was immediately able to identify that what the signs were that I was possibly going through postpartum depression. With that being said, my primary physician suggested that I go see a therapist, and I did go to the therapist, a psychologist, and after being evaluated, she did recommend that I begin an antidepressant that would also help with the anxiety that I was experiencing. Um, Both of those treatments worked tremendously. Initially, I would go into counseling or my therapy sessions bi-weekly, every other week, and would meet with my therapist for about 45 minutes at the time. So, with that treatment and just being able to talk through what I was experiencing and finding out that honestly, that's not something that is uncommon, that is very common. And I really felt better knowing that it was actually treatable. It wasn't something that was going to be long term or that would last forever. In addition to receiving the therapy, like I mentioned, I was given some antidepressant medication that also helped with the anxiety. So gratefully, the medication did work. I started to come around to see a difference definitely within a month or 6 weeks of taking the medication and receiving therapy. From there, I started to feel more like myself, being able to be home with my daughter, starting to get back into the habit of driving to places that I needed to go, um, and just started to take care of more of the daily routines that I was used to doing. So, if there were any other mothers out there who are going through postpartum depression, or you may feel like you're suffering from what they call the baby blues, I would definitely recommend that you speak to someone. First and foremost, if you have a spouse or family member, mom, or someone, that they would um, just take notice in you and just ask them a few questions if they notice anything different about you or within you. If they agree, then you should definitely seek
medical attention so that you can be connected to a therapist who is very educated in postpartum depression and who can get you on the right track and give you the correct medication that's needed. I hope this helps. Take care.